Good evening. This is again Professor Triple N or Nick PA from Brooklyn, New York. Today is April 8, 2022, about 10 p.m. And I would like to introduce my lectures for medical ethics. If you have any questions, please feel free to email me to my email, nickmd1@gmail.com. Once again, nickmd1@gmail.com. Let's start with one famous case of Justice Benjamin Cardoso, Schondorf, vice versa, Society of New York Hospital. Here we have a famous quote that every human being an adult in adult years and sound mind has the right to determine what should be done with his or her own body. Example, a surgeon which performs operation without patient consent is committed assault, except the case of emergency when the patient is unconscious. There is in this landmark decision, in one sentence, there is a fundamental premise which underlying half of the ethic questions, which includes number one, autonomy, number two, adult, number three, capacity to understand. This is the end of slide one. Let's go to slide two, and we'll talk about autonomy. I'm sorry. Patients are supposed to have the sole right to determine what kind of treatment they shall or shall not accept. Autonomy ethically is more important than beneficiency. Beneficiency, which is trying to do good for others, is generally a good thing, but trying to help someone is not as important as following her wishes. There is here a clinical tip which states that patients have the right to refuse treatments which are good for them if they do not want them. And we have here a couple of clinical examples. A man has an ugly house and you offer to paint for free in his favorite color. Everybody agrees that the house is ugly from the neighbors. The man will not have financial obligation in exchange. He understands everything which you're offering, including the clear benefit for him. The man is still refusing. What do you do? The right answer is A, honor the man's wishes, do not paint anything. So the rest of answers are paint his house against his will, C, ask the neighbor council to consent to paint for the painting job, D, get a psychological evaluation of the man, E, get a court order to allow to paint the house, F, ask the family for consent to paint the house, and G, wait until he's out of town and then paint the house. So the right answer here is A. Seemingly silly example which allow you to answer the majority of the questions. Cost and benefits and the common good are not important as the autonomy individuals have to just do what they want within their own property. Another example, a man comes to emergency department after MVA and he has a ruptured spleen. At the present time, he is still fully conscious. He understands that he will die without splenectomy. He refused the splenectomy and refused blood transfusion. His family is presented, including his brother, which is his healthcare proxy. Both the family and the proxy, the agent, the person, and the document completely only a few weeks ago clearly states everything possible should be done, including surgery. What do you do? Is the question. Let's go to the next slide. A. Honor his current wishes, no surgery. B. Wait until he loses consciousness, then perform the surgery. C. Psychiatric consult. D. Ethical committee. E. Emergency court order. F. Follow what is written in the document, documented healthcare proxy. And G. See if his consensus from the family. The right answer here is A. You must follow the last known wishes of the patient, even if they're verbal and even if they contradict to the written proxy. If the patient writes one thing and 10 minutes later changes his mind, you go with whatever is the last clear wish are. So the right answer here is A. Honor his current wishes, no surgery. Let's talk about advance directive. Advance directive tell the caregivers the parameters of care that the patient wants. The agent is the person designed by the patient to carry out the patient's wishes. The term is sometimes used interchangeably with healthcare proxy. The healthcare proxy is a written document outlining the parameters of care. The major problem with the proxy is that the details of care are often not clear. The healthcare proxy takes effect only when the patient loses the capacity to make decisions. Order of decision making. Number one, a patient with capacity supersedes all else. 2. Healthcare proxy that includes agent or person to carry out wishes. And 3. Living will. The living will is a document outlining the patient wishes. A document clear start. I never want dialysis is more valid than, let's go to the next slide, than the family member or a friend saying, from what I know about him, he doesn't want dialysis, or he told me he will never want dialysis. Advanced directives are matter of documentation. So we are on slide 4. Number 4, persons clearly familiar with the patient's wishes. The problem with this is one of the documentation. If the patient loses capacity, it is difficult for a friend to document that she knew the patient wishes better than the family. Number 5, family. In general, the order of decision-making starts with the spouse. If there is no spouse, then we go to adult children, parents, then siblings. Ethics committee. Ethics committee, this is important when a patient has lost capacity to make decisions and advanced directives are missing or unclear. The ethics committee is also important on the issue of medical fertility. Court order. The court order is important when the patient has no capacity to understand and the family is in disagreement. It is like a house being left equally to 4 children who cannot agree what to do with it. Number 1, a patient has no capacity or proxy. Example when the court order are needed. Number 1, a patient has no capacity or no proxy, and his family splits about how to continue the care. Number 2, caregivers wants to withdraw care, and the ethics committee cannot reach conclusion. Let's go to slide number 5. Psych evaluation of the patients. Psychiatric evaluation of the patients. Psychiatric consult important when it is not clear if the patient has capacity to understand. If the question clearly states that the patient has capacity to understand, then this type of evaluation is not needed. Minors. Minors do not have decision-making capacity. They cannot consent to or refuse medical treatments. Only the parents or legal guardians can consent or refuse. Exceptions are contraceptives, prenatal care, substance abuse treatment, and STDs, including HIV and AIDS. Abortion. The states are split on parental notification laws. Some require it and some don't. Your answer will be something like, tell the minor patient to notify her parents. There is a tip here, is that the PANP boards wants you to discuss, educate, explain, and confer before everything else. Consent. Only an adult can consent the procedure, and each procedure needs individual consent. Consent is applied in an emergency. The person doing the procedure, let's go to the slide number 6, must obtain consent. Adverse effects of the procedure must be explained to make the consent valid. And consequences of refusing a procedure must be explained also. Pregnant women can refuse procedure and treatment for their unborn children. Telephone consent is valid. And here we have 2 examples. A patient signed consent, number 1, a patient signed consent for an ovarian biopsy on the left side. At the surgery, we found cancer on the right side. What do? Answer. Wake up the patient and obtain consent to remove the ovaries on the right side. Very good. Number 2 case, a patient needs colonoscopy. the gastroenterologist asks you to obtain consent for the procedure. What do? The answer is the gastroenterologist who performed the procedure needs to obtain consent. So that's a good answer. Let's go next. Do not resuscitate orders or DNR. Do not resuscitate or DNR orders refer only to withholding cardiopulmonary resuscitation. They don't refer to withholding any other form of therapy. And we have here one example. A patient with capacity consent to DNR before losing consciousness. She needs a surgical procedure, but the surgeon refuses because of the patient is DNR. What do? Answer: perform the surgery. DNR does not mean withholding antibiotics, chemotherapy, or surgery. DNR means only if the patient dies, you will not attempt resuscitation. Very good. Now let's go to discuss physician-assisted suicide. Physician-assisted suicide is always a wrong answer. This includes states which are legal to do so. Ethical requirements for physicians supersede the legality. Physician-assisted suicide is administered by the patient, but this is still unethical for the physician. Let's go to the next slide. There is a clinical tip here which states that physician ethics come before legal requirements. You cannot do something unethical even if it is legal at the moment. This is slide number 7. Euthanasia. Euthanasia is a physical administrating treatment intending to end or shorten the life of the patient. It's always wrong. Let's talk about terminal sedation and law of double effect. It is accepted to administer pain medication even if there is a possibility of treatment shortening the patient's life. Example, it is accepted to give a patient pain medication to a person with COPD which has metastatic cancer even if the only way to relieve pain is to give enough opiates that the breathing may be impaired, causing the patient to die early. The question is one, if the medication are given with the intent to relieve the pain and as an adverse effect they shorten the life, it is ethical. It is the primary intent is to shorten life, it is unethical. Let's discuss here so-called futile care. A physician is not obligated to render care that is futile even the family or patient wants it. If the patient is brain dead and the family insists that you continue the mechanical ventilation, you are under no obligation to do so. You are under no obligation to perform tests or treatment you consider worthless. Let's discuss here organ and tissue donations. Payments for organ donations are unacceptable. However, payments for renewable tissues such as sperm and eggs are acceptable. Let's go to slide number 8. Let's discuss here consent for organ donation. Only an organ donor network should ask for consent for organs. It is an ethical conflict of interest for the physician to ask for consent for organ donation. The organ donor network also has fewer refusals than the physician. Organ donor cards give an indication if the patient wishes, but the family can refuse organ donation even if the patient has no organ donor card. Let's talk about confidentiality. It is the patient right of confidentiality can be broken when there is a danger to others. Example of ethical acceptable circumstances like confidentiality as STD, HIV/AIDS, airborne disease such as TB, and court orders demanding information. Confidentiality is important, but not as important as protecting others from harm. The patient right for confidentiality cannot be broken by employers, co-workers, government agencies, or family and friends. And there is an example here. A patient with HIV/AIDS has repeatedly refused to disclose his HIV status to his sexual partner. The partner accompanies the patient to the office visits, and it is waiting in the waiting room. The patient insists you do not tell the partner. What do you do? A. Honor the patient wishes. B. Obtain a court order. C. Consult the ethical committee. D. Either the physician or the Department of Health can notify the partner. The right answer is D. You have the right to notify the partner or to disclose the patient's HIV status to the health department so they can notify the partner. The confidentiality of the patient is not as important as protecting the health of the patient. The health of the partner, I'm sorry. Let's go to the next slide. This is slide 9. There is a clinical tip here which states that HIV positive healthcare workers do not have to disclose their status to their patients or their employers. Wow. And there is a example here, a clinical example. A woman comes to your office with valid identification from the government agency that works in law enforcement. She requests a copy of your patient's medical records. What do you do? The answer is you are to provide healthcare protective records to government agency, including those from the law enforcement, only if they have a valid warrant or subpoena from the court. To do otherwise would be a violation of the constitutional protection against illegal search and seize of properties. This would be also constitute a violation of a HIPAA, which is designed to protect the health information. Wow. Let's talk about doctor-patient relationship. The physician is not obligated to accept everyone coming to him or her as a patient. Patient has the right to end, and the physician has the right to end the doctor-patient relationship, but must give a patient sufficient time to obtain another caregiver. Small gifts from patients are acceptable as long as they are not tied to a specific treatment request. A romantic and sexual contacts between patient and their current physicians are never acceptable. Yeah, I could do the gift from industry. Unlike a small gift from a patient, gifts from industry such as drug companies are never accepted. Even small items from the industry such as pens, pen lights, pads, and cups are unacceptable. Meals in direct association with the educational activities are not considered gifts. So only meals. Chinese food. Voila. Okay, let's discuss doctor and society. Elder abuse. Let's go to the next slide, number 10. You can report elder abuse against the consent of the patient. This is based on the concept that abuse older adult may be too weak, fragile, or vulnerable to protect themselves or remove themselves from the environment of potential harm. Elder abuse is treated ethically like child abuse. Let's go to the next definition. Domestic violence and spouse abuse. Unlike child abuse, domestic abuse cannot be reported against the patient's wishes. You can report and intervene only with the consent of the patient. Let's discuss so-called impaired drivers, seizure disorders, and driving. This is one of the least clear areas nationally, and the states have no uniformly. They are not uniform on the laws in this area. You must answer, suggest that the patient find another means of transportation. Wrong answer would be number 1, confiscate car keys and reporting to law enforcement. B, hospitalization of the patient. C, refusing to let the patient get to her car. Let's discuss execution of prisoners. It is never ethical for a physician to participate in execution at any level. You cannot ethically formulate a lethal injection or even do so much as pronounce a prisoner dead. Even in state law makes exceptionally legal, you are a physician which do not participate at any level. Torture. Physicians are never participating in torture of prisoners or detainees. Even if the question states that you are in the military, your ethical obligation as a physician supersedes your obligation to the military. This would include, number 1, refusing orders from the military superiors to participate in torture. Number 2, keeping the torture safe so that it is not fatal or damaging. The ethical question of torture are easy to answer because of your answer is no. Let's go to the last slide. So your answer is no at any level of involvement, even if you are in a military position in a legal war zone. Those role is simply to protect the patient against permanent harm. There is a clinical tip here. Torture is an ethical equivalent of child abuse. Your participation is never acceptable. You are obligated only to report it. So this is the end of the lecture, and thank you so much for your attention. Once again, this is Professor Triple N, NNN, or PA Nick from Brooklyn, New York. If you have any questions, please feel free to email me at my email, nickmd1@gmail.com. Thank you and good night.